You live here.
Morning, everybody. I would like to call to order the Public Health Committee meeting for Wednesday, May 21st. Boy, I sound really loud. Do I sound really loud?
No.
You're okay.
All right. I'm Cheryl Strathman and I'm chair. And I would like to let you all know that today is very appropriate. It's National Employee Health and Fitness Day. How about it? But it's also National Strawberries and Cream Day, so that might interfere a little bit with the national health part. Just saying. So, good morning, everybody, and would you please call the roll?
Arroyo. Juby. Here. Genesis.
Hennis here.
Tarver.
Tarver's here.
Young.
Here.
Sanchez. Strathman.
Roth here.
Okay, and we have a remote request for Mr. Tarver. Is that any objection?
No.
Except for Miss Juby and Mr. Gripes, there's no objection.
Hey, Bill.
Okay. And I would like to ask for a unanimous consent for the approval of the minutes from April 16th.
Hennis moves.
Pennis's moves with the
Unanimous consent.
Okay, any objections? Okay, so be it. And now I'd like to start with public comment, and I have two. First one I have is Miss Meyer, Miss Jeannie Meyer.
Out from me. And I guess this is.
Everybody get a handout. We
on.
have some up here.
I do.
And everybody has one.
Thank you. Jean Meyer, RNMS. Listening to the comments here the last couple months on how the unvaccinated have brought back measles from being eliminated in 2020. The elimination is defined as the absence of continuous spread for 1 year. I have some comments from lots of reading. Number one, see the graph on page 1 showing that the death rate for measles had dropped nearly to 0 well before the measles vaccine in 1963. Pharmaceutical companies don't want to recognize this, wishing to get the recognition for saving lives when this is not the case. Repeating, the death rate from measles dropped to nearly 0 before the vaccine. This highlights that factors beyond vaccination play a major role in disease outcomes. Number two, now look at the risk-benefit ratio on page 2 of the back one. Measles might be uncomfortable, but if I had a child, I would risk the measles instead of the serious side effects given in the FDA package inserts, including vasculitis, pancreatitis, thrombocytopenia, encephalitis, Guillain-Barré syndrome, pneumonia, nerve deafness, retinitis. Those are not good things, and there's many more there. In addition, many parents claim their child became autistic after the MMR. But since this does not follow the narrative that makes money for pharmaceuticals, those in charge refuse to follow the science and do real research. Number 3, take a look at things which cause a lot of death that health officials could care less about. Death from medical error is the 3rd leading cause of death after heart disease and cancer, claiming more than 25,000 Americans yearly, with some sources saying up to 440,000. Stay away from healthcare? That reminds me that famous doctors that I respect say medical error and not measles killed the 2 Texas children. This story does not meet the narrative to keep the lucrative vaccine industry alive. So these doctors that are willing to risk their licenses to speak truth are labeled nuts from a fringe group. Also causing lots of death that public health could care less about, and I'm not talking about you guys, is that more than 178,000 deaths are caused by alcohol abuse annually. In closing, my purpose is that you will keep an open mind and listen to the opposing side, including the well-documented 8-point measles fact sheet I gave you, the 2nd page, and it's double-sided. Recognize that the love of money, the pharmaceuticals' love of money, is the root of a lot of evil, and then don't promote fear. Thank you so much.
Thank you. And David Young.
Hi, David Young. I guess this is going to piggyback on what Jean just said, but as I was looking at today's and preparing for today's meeting and looking at the resolution as well as the proclamation, I just think that our public health department needs to do more about public health. I mean, what are we doing here? The proclamation is totally politicized. It's about guns. How many people die from guns? A handful. And it's sad and it's wrong. People die from guns. But what about all the people that she just mentioned that die from heart disease, obesity, cancer? And what is the public health department doing to help our citizens live healthier lives? Coming out with, I don't know, hey, if you're 25, don't drink a bottle of Jack Daniels every day. And if you're 55, don't eat 10 chocolate chip cookies every day. I mean, come on. It's that simple. And it just gets frustrating because now I'll be speaking out against this proclamation because this is totally politicized. I want to see the public health department do something for public health. I mean, heart disease, obesity. How about just in mental health, as well as just as people get older, they get these different kinds of diseases, be Parkinson's disease or whatever. How can we avoid that? What about eating a healthier diet? What about taking, vitamin D, B12, simple stuff. But yet this is what we get, the resolution today. Thank you.
Okay, thank you. Okay, and the reports are on file if there are any questions. Okay, and then we'll turn to our animal control, Brett Youngset.
Good morning, everyone. My data is all posted for everyone to see, and I do have 3 fun items today to discuss. The first one's our clinic data. Our first 2 clinics have already run. where our third one's coming up June 14th. That is a Saturday from 10 a.m. to 1 p.m. We're very excited. So far in our first two clinics, we have done 236 rabies vaccines, 189 dogs and 47 cats. For those of us keeping numbers, that's 36.51% have been seniors on dogs, and on cats, 46.8, which is fantastic. So really good numbers so far. We're starting very strong and we're very excited. We want to keep it going, which leads into my next one. Our final 3 vaccine clinic dates are being finalized right now. So hopefully at next clinic meeting, I hope to have that ready so we can start our push for those August, September, October clinics. So we're very excited about that. We do have a new credit card coming. So I brought a resolution forward last year for a new credit card company. Right at the last second, the interest rates were very high. I didn't think that was fair because we do have a fee of $1 at our facility. So with that $1 replacement tag fee, you were also paying $1 to the credit card for a fee. That didn't seem right to me. So I went back with the state's attorneys and we rebidded it. And we're currently looking at Illinois ePay that has the best overall for our facility for what we need to get us with online credit card payments and to be able to keep the rates low for our citizens. So I'm going to be looking into that and we're hoping to bring that resolution forward soon. The state's attorneys just wanted to make sure I kept you guys up to date on that at all times. The last thing I have is very exciting. We have made a temporary offer to a new veterinarian for the county. He has accepted. He is currently doing background checks. So I hope to have more data on that next month for you guys. The date that Dr. Davis is leaving us is June 30th, the end of June, and the new veterinarian will be starting July 1st. We're very excited right now. He comes to us with a massive background. The county, I think, is going to be very lucky to have him on board. I am always here for questions, concerns, problems. Please come find me. If you want a tour, please come see me. Thank you to all the new board members who have come. And please let me know what I can do to help you. Thank you.
Thank you. Do we have any questions? Yes, Mr. Gripe.
2 questions, Brett. Thank you again for everything. Is there a a coffee or something for Dr. Davis?
Not yet, but yes, we are planning something.
Okay, all right.
Okay, keep us posted.
Yes,
let
I
it
definitely
know.
will.
And were you meaning a payment processor, not a credit card?
Yes, and I apologize for misspeaking. It is a payment process company, not a credit. And I'm sorry, I'm learning the language to myself, so I apologize for that. It is a company who allows us to then process ACH payments and credit card. Yes. Thank
Good.
you. Sorry for that.
Ms. Juby,
It's run through the Illinois State Treasurer's.
what was that?
Yes, Illinois ePay is through the
Illinois Treasurer's office.
Yeah.
Oh, okay.
Other animal controls are using them. That's where we got the idea and has gone through the vetting process. Now we're going to start the next process, which is communicate with them, start the paperwork, go through it with the state's attorneys, and then hopefully have a resolution for the board soon to get that in place.
If I may, will that allow, and one of the 2 of you might know or both, will this allow online donations to the animal shelter?
It is our hope that this will allow for that. Yes.
Excellent.
That would be great.
Yep.
Well, thank you for being diligent about that, for watching out for people. That's good.
I know it's pennies we're talking, but at the end, pennies do matter. So
It does all
our
add up.
department is all about saving pennies and nickels, paying for everything. So it's only right that we continue to watch that for our citizens.
Saving lives or saving pennies, right? Thank you. Anything else? Yes, Mr. Young.
Right, David Young, I was looking, I mean, we're all into this whole budget crisis mode. So I just wanted to, I looked at the salaries for 2021, there were 462,952. And for 2025, they're 793,555. So that's a 171% increase over 4 years. And I guess I just wanted to, was I reading that correctly? That the salaries have increased by 171% over 4
Correct.
years?
We have been massively underpaying like most departments here in Kane County. It was to the point where front desk and kennel staff were changing over yearly. This is the first time Kane County has actually had solid employees stay through and stay with us. Our department is able to do things today that I was not able to do 6+ years ago, even when I started, just because your turnover was so high, you were focused on day one stuff. You know, here's how to answer the phone. Here's how to explain the laws to people. They're actually doing advanced things like creating our flyers now. We're actually able to utilize those staff members to better service our citizens of this county because they can better respond to calls now. They can better work through things. The processing is much better with long-term client or long-term staff. We all know that. The longer staff members stay, the more they learn, the more they're better for the county. We really have an amazing team right now running this facility that we're able to respond to our citizens' needs better today than we were 5-10 years ago.
I would also like to say that he also, again, being responsible, had, rather than hiring another person, which is more benefits and more training and all that, also increase the hours of some of his people. So that would also show as an increase in the.
Correct. So we moved, half of our staff was at 40 and half was at 35. We never knew why one was the other. All animal controls in the area at 40, bringing those staff to 40 hours. The productivity we're getting out of them is so much better too. Again, we have to process all these tags in the county. All this stuff has to be entered in the computer system. There's a lot of paperwork stuff that has to be done that this animal control facility is running leaps and bounds better today than it was 10 years ago.
Okay, as a follow-up then, are more, are you seeing more animals then for 2025 versus 2021? And does that itself bring in more revenue so that it balances out?
Yes, there is greater, we've had a higher call volume, especially with everything going on in the economy right now. Larger amounts of strays, and yes, that equates to more revenue being received into the facility. So does also population growth. So as King County continues to grow, that also continues to the amount of people that then own an animal, therefore that have to register, that then filter back into this facility as well.
Well, but King County isn't growing. I mean, it's flat or losing population, but you answered the question, but King County isn't growing.
So,
Okay.
and I don't, sorry, that's more into the weeds than I would know. I just see from 10 years ago to today, we've had.
You see more people.
Yes.
Okay.
Sorry, I didn't mean that statistically.
No, that's okay. Thank you.
Any other questions? Okay, thank you. I will say I went down to the one drive-through and it was really fun to see how that operation works. And it was a beautiful day and people were enjoying it. It was fun. You do a good job. So thank you for that. Okay, moving right along. Our Executive Director, Michael Isaacson. Good morning.
Good morning, everyone. Nice to see you all on this nice misty day today. A couple of quick things that I want to cover. One, unfortunately, in March, we received a notice from the Illinois Department of Public Health that one of our grants, respiratory surveillance and outbreak response grant was being eliminated at the federal level. There was some uncertainty. The state of Illinois is party to a lawsuit that is actually ongoing. So there is a temporary restraining order with those funds, but we don't have any assurances on payment for that grant, and we have no way of predicting what's going to happen. As it stands, we're going to lose just over $700,000 in funding because of this. And as a result of that, and because of the way that the King County Health Department is funded, we have had to eliminate 4 positions that are associated with this grant. So we were able to move 3 employees into other existing grant-funded positions. So that's a positive thing, but we do have 4 fewer people who are out there serving the public in King County now because the way we're funded, when grants go away, our positions go away. And I will point out just in reference to Mr. Young's comments about chronic diseases, for example, in my time at the King County Health Department, we have done a lot around chronic diseases, but it's been grant funded. And when those grants have gone away, those people have gone away and those programs have gone away because that's the way we're funded. So just a little background and I think I've mentioned this before, but I think now is the time to beat this drum for the budget conversation. When we assessed local support for public health in the Chicagoland region, King County was the lowest funded with property taxes out of any health department, in some cases significantly by a scale of 10 to 1. So what does that mean? Property tax funding for us means that we can spend that money on what we think are the biggest issues. For example, chronic disease. We get about $2 million in property tax funding through a special public health property levy. $2 million now. About 5 years ago, we received $2 million. About 10 years ago, we received $2 million. About 15 years ago, we received $2 million. So we have had just level support at the county level, as of course many departments have, but we get zero funding from the general fund. So we have very little funding that is unrestricted, to use kind of the nonprofit world language. We run mostly on fees that support our programs and on grants. And each grant is a project. So it is time bound and it has its own specific deliverables. Now, certainly we only seek out grants that are aligned with what we think are the public health issues in our community. So we're not just willy-nilly taking any funding that people throw at us. However, we must meet the deliverables of that funder. So we're in a position with any funding, we don't have the flexibility to do what we'd like with it necessarily. We don't have the complete freedom to do what we'd like. And I don't disagree with Mr. Young's comments. There's a lot more I think we could do around chronic disease if we had funding to be able to do it. So as of right now, we're anticipating, because I can't risk the exposure for the health department if that funding goes away and we had spent the money and didn't get it reimbursed. So we had to make the decision. So as of next month, that grant will go away for us. We have eliminated that headcount from our budget. It won't be appearing in the 2026 budget. And we're moving forward from there. So I don't know if there's any questions about that. It's unfortunate when this happens, especially it's strange. It typically doesn't happen when we have a signed contract and we're in the middle of a grant year. That's a little more unusual for us, but.
Yes, Mr. Penistus.
Thank you, Madam Chair. So 3 of those people were moved into separate grants that you're currently conducting, so they would be paid through those. That one person that you're not going to be able to cover if, for example, this money does come through, hopefully, we could move those 4 people back into those positions. Is that one person going to be available?
Yeah, and I should have been more clear. I apologize. One was a vacancy. So we were able to get through without anyone losing their job this time.
Okay, great.
But we're out of vacancies. So if the next cut, we're not going to be in as positive a situation. And just as a reminder, especially for the newer folks, in 2010, we had some cash flow issues at the health department and we laid off half of our staff. So I did, and this is admittedly me defending the health department here, as there was some conversation at the special finance meeting yesterday about, growing departments and the larger strain. We currently have about 50 fewer employees than we had 15 years ago. So we're not putting any additional strain. I mean, I'm very thankful for the services we have here at Kane County, but we're actually a much smaller department. Our payroll needs, our finance needs, our HR needs are significantly smaller than they were 15 years ago still. We've been able to bring in a lot of funding. We have a resolution for a grant that we've applied for on the agenda today. So we've been aggressively seeking out new funding so that we can increase services to the public. But it's all dependent on if we get these grants or not.
Yeah, and I'd just like to, add, the programs that you guys run are fantastic. It's all grant driven. Love to see more, chronic disease education, some preventative, prevention is key, to hold down costs. But, we understand it all comes down to the grants and appreciate everything that the public health department does. You guys are great. Thank you.
Thank you. And we have a tremendous team. And I echo what my colleague here said. We have some great people who've been here for a while who have really built up the skills. We have some tremendous new people too. We've got a great leadership team. So yeah, we're very fortunate in Kane County with our team, definitely.
And sometimes I think, we throw around in all our meetings the word grant. It's not an easy process. And it's complicated. And sometimes I think we just take for granted grant. We don't think about anybody who has seen what the process is or has been a part of the process. It's rigorous. And there's no guarantees when you apply. And
Right.
it's a lot of work to get a no. So thank you for being as diligent as you are and as successful as you are with your grants. So, okay, next.
Next is a little more positive, I think, and anybody who maybe participated in development committee yesterday may have heard. But there is action underway that will be reorganizing the Office of Community Reinvestment. So I've been in a conversation where there's potentially 5 staff from that office that would move over to the health department. My understanding is this will be brought to the board in June, I think is what the plan is. So just wanted to plan, because it was mentioned yesterday, I believe, I wasn't at development, but this would be work around homelessness and housing, which are very mission aligned with the work that we do at the health department. It is federally grant funded, but based on our analysis, it looks like those funds are in place for the next several years. So we've talked to the staff, so they're aware that this is going on. I haven't talked to my staff too much about it yet because it's still new and the board hasn't weighed in on it yet. But that's something that over the next month or so, we'll have a lot more information about.
Any questions about that? More to come.
More to come.
Wait, Lewis online. Sorry, I couldn't find my hand.
Oh, I'm
Permission to
sorry.
speak?
Yes, Ms. Lewis, go
You're
ahead.
good, you're good. So, I'm sorry, but I did not attend the meeting yesterday either. Will these people be going into the Elgin building or into the Aurora building?
It's still to be determined. Most likely in Aurora, we may have to cannibalize one of our conference rooms to change into office space, at least temporarily. They're currently based in Batavia right now.
Right. I get it. Okay, thank you.
But we're still very preliminary in
Yeah.
any planning. So.
No, and that's why I'm not asking further questions. I was just curious. Thank you.
Also, I will be giving testimony to Illinois House Appropriations Committee this evening around the local health protection grant. So this is our core grant funding project. I'm giving testimony on behalf of the Northern Illinois Public Health Consortium, which is our member organization. It's 17 health departments in the Chicagoland area. Local health protection is our core funding for local health departments across the state of Illinois. We had about a $5 million reduction statewide in that grant funding from 2024 to 25. So we're hoping that money gets reinstated. Obviously, just like in Kane County, it's a tight budget year in Springfield as well. And we don't know what's going to happen in Washington, D.C. But this is something I'm thankful for the support of the legislative committee and all my colleagues as we advocate for more funding from Springfield to come back to our home community so that we can provide more services. We lost about $150,000 with that cut in grant funding between last year and this current year. So we're looking to get that restored and hopefully more. So.
Yes, Ms. Juby?
Are you working with our lobbyists? Okay, great. And they're meeting you down there today?
I'm doing remote testimony.
Oh, okay, okay, thanks.
Okay.
And
Is
then
there, excuse me, is there witness slips that we should be filling out?
I can coordinate that with Ms. Gomes if that's appropriate.
Yeah, that's fine.
Okay.
And then we did want to spend a little time specifically talking about measles. So Director Onwuda has a presentation that she's going to share just to give an update on what we're seeing around the country right now. So we can pull that up. Thank you.
Good morning. Can everyone hear me?
Maybe get a little closer to the mic. Or talk louder. Yeah.
Can you hear me better now?
There you go.
Microphones are better than others. Good morning. My name is Uche Onwuta, and I'm the Director of Health Protection at Kane County Health Department. At the request of the committee, I am here to make a presentation on measles. Okay. So, let me start by saying that we do not have a case as of now here in King County. Around the country, we have, as of May 15th, 1,024 cases around the country. Breaking it down by age, most of the cases are among the school age group 5 to 19 years at 38%, adults 32%, and under 5 years, 29%. In Illinois, we have a few cases right now, 8 cases in Illinois. So most of the cases, well, we have 1% of the cases unknown, age unknown. Most of the cases are among unvaccinated people or those who we do not know their vaccination status. 1 or 2% among 1% among those with 1 dose of MMR, and 2% among the those with 2 doses. So measles is a very serious disease. 128 cases of those 1,000 are hospitalized. Looking at age group, you can see that most of the cases that are hospitalized are under 5 years old, but a good number of them are still among the school age and the adults. Now, this year we've had a total of 3 deaths. 2 of those cases were among the school age group between 5 and 19, and 1 of them is an adult. Those 2 children who died were unvaccinated, and they had no known underlying conditions. So just a little bit about measles. It's airborne and it's extremely infectious. One thing, for instance, if somebody in this room had measles and they just left now, anybody coming into this room is still infectious up to 2 hours after the case has left the room. So this is why measles is a very serious disease, highly infectious, and a serious problem for us to monitor and contain. It's spread through coughing and sneezing from an infected person or contact with the mucus of saliva of an infected person. And 9 out of 10 non-immune people who have contact with someone with measles will definitely catch the infection. Some of the symptoms are high fever, cough, runny nose, and conjunctivitis, which is red or watery eyes. And of course, the maculopapular rash, usually originating from the face and spreading the face hairline or neck and spreading down from there, lasting about 3+ days. So we've had some spikes of measles cases over the years around the country, mostly starting in areas where, in communities where maybe for religious reasons they're unvaccinated, or cases coming from, we've done a good job vaccinating school-age children. So this has actually helped to contain measles. Just wanted to show this slide, which is school vaccination coverage dashboard that IDPH has put together. Okay, so looking at these bars, you can see that the light blue bars are where we have high enough immunization rate to meet the threshold. And we can see from school year 2021, 2022 into 2022, 2023 and beyond, our numbers are getting lower than the high threshold. So what that means is that a chance of sustaining an outbreak is increasing as we're looking yellow. Okay, so a little bit about how infectious, the infectious period for measles. People are infectious 4 days before the onset of rash and to at least 4 days after rashes have appeared. And so the incubation period is 7 to 21 days. So if you were somewhere had an exposure to somebody with measles, it could be like in the last 2 weeks, you went on vacation, traveled outside the area and you went to a measles outbreak location, came in contact with somebody with measles, you wouldn't know that you're spreading the disease because 4 days before onset of measles, you're still infectious. So I just want to make a note about this. Some years back when we had a case of measles in the area, it overwhelmed our system. We had like 200 contacts out of one case of measles. And what that did is people who were exposed and they had to be quarantined, you lose time time from work or daycare, or your child is sick and you have to be home from daycare. People don't know where their vaccination records are. So, we had to make so many calls, trying to get people to submit their vaccination records so that we can confirm that they're immune. So all of that inconvenience can be eliminated if we simply, vaccine is the #1 way to prevent measles. Some complications of measles: ear infections, diarrhea, pneumonia, encephalitis, which is swelling of the brain. And as we've seen this year, 1 to 3 deaths per 1,000 cases. And we had less than 1,000 cases when we already had 3 deaths. So just a little bit about measles vaccine. Was introduced in 1963. Prior to measles vaccine, each year, 48,000 hospitalizations were experienced in the United States, 400 to 500 deaths. We know that 1 dose of MMR vaccine is 93% effective, and 2 doses are 97% effective. And I did mention that 96% of the cases this year were among unvaccinated persons. So what you should know, we have currently outbreaks of measles in several parts of the country, including here in Illinois. Measles is highly contagious, and we have enough competent staff and tools to manage measles. However, an outbreak of a few cases can easily overwhelm our system. We need your help to protect you and your community. So how can you help? One thing that I really, really want to stress is to call your healthcare provider first before going to the emergency room if you have symptoms of measles. I can't stress this enough. If there's anything that we take away from this is we don't want people going to the emergency room with symptoms of measles, because what happens, just like I said, we have people who, sick people who are in the emergency room, and then you bring in a case of measles, they're more likely to get infected. And then shutting down the ER for 2 hours is not the best thing for us at that time. So please call your healthcare provider ahead of time before going to the emergency room. Know your vaccination record, where your vaccination records are. Please. I put in here the VaxVerify portal. You can go to the portal and get information about your vaccination records if your healthcare provider entered that information in iCare. Another way to find out is calling your doctor. You know, the doctor's office is required to keep your vaccination records history wherever you got vaccinated. So please take the time to find all of that information and keep it by you, because that could be a difference between taking several days of work, you know, because you don't know where your vaccination records are and you have to be quarantined. Also, if you're told that you have measles, please isolate, you know, so that you don't get other people infected. So what is Kane County Health Department doing? What steps have we taken? We have constantly posted, you know, social media posts, you know, regarding measles and what to do. We've held several webinars with healthcare providers, schools, and daycare centers. We've been having meetings with emergency department staff, clinics, infection preventionists in the hospitals. We've been providing guidance to healthcare providers, giving them current information. These things change every so often. So making sure that they have the right information, you know, where they can send their specimens for testing, how to collect the specimens. We have to give them authorization number to get the PCR test. And, you know, to remind them to send the specimens to IDPH, because we can get the results faster and can mitigate sooner than if they went to commercial labs. We've been constantly updating our measles webpage, doing our contact tracing, case investigation. You know, we're getting alerts from IDPH, you know, whenever somebody shows up with rash illness, and, you know, following up with it, you know, weekends, weekdays, whenever it is, we're there to help. And we're reviewing our measles emergency plan. And I think I included a couple of flyers that we've been sharing with healthcare providers and the community regarding measles. This is it. Any questions?
Yes, Ms. Juby.
So I'm in that perhaps warranty bubble age where things, you know what I'm talking about. Do measles antibodies titer? Can I titer for that? Or do I just have to go in and get all the shots over again? I can titer for all of my childhood immunizations? Sorry, I don't know who to ask. Someone who's going to tell me, yes, I don't have to get all those shots. That's who I want the answer from.
You can actually get your titer to find out whether you're immune or not.
Okay, do you guys titer?
No.
Okay, all right, thanks.
Any other questions? Yes, Mr. Panessas.
Yes. What are we doing as far as, and Director Isaacson mentioned this, I think it was last month when I asked the question. We see that rate. There's a lot of vaccine skeptics out there. A lot of it's due to misinformation, honestly, by what's happening right now. And I got to say this, RFK Jr. even came out and said with this measles outbreak, he said he'd vaccinate his kids. And he's the noted vaccine skeptic out there, which has caused the situation we're in right now. But we see the rate dropping with school rate kids into that medium category, which is okay, but it's dropping, which is not good. That's kind of troubling. What are we doing as far as like homeschool kids, which is something that Director Isaacson mentioned? We don't have any records. Is there any outreach that we're doing with them?
Okay, so I will let Director Barrett, who is in charge of immunization, answer the question, the immunization question.
So we continue to do outreach at different activities throughout the county about vaccination, making sure that you are up to date. Of course, right now, there's a big push for kids going back to school. So we've got the flyers out. They've gone out to all the school districts to send them on out. Some of those homeschool children do actually go to some of our local schools because they participate like in art or music or sports that they might be participating in. But there's no known group that I know of to reach out directly. If there is one, send it to our way. We'd be more than happy to talk to them or give them information if they want to on it.
And I will add that, and this is an area, as you mentioned, we've seen a decline over the last several years. The health department coordinated a campaign, and the timing couldn't have been worse. But during COVID, we received funding to do a campaign in the Chicagoland area with vaccine hesitant parents. And this was before COVID started, the grant started. So we did a lot of focus groups and talked to people. My approach for any public health issue is you really have to start where the people are. And in talking to vaccine hesitant parents, and so this is not diehard anti-vax people, but these are folks who say, I have a lot of questions, I have a lot of concerns, or perhaps I don't plan on keeping my child vaccinated on schedule. I don't want them to get all those shots at once, whatever the case may be. In conversations with those folks, I think one thing that rings clear is we know the parents want what's best for their kids. And so we developed a campaign that really was focused on empowering parents to make the right choices for their kids and giving people the information, trying not to be paternalistic about it, because none of us respond, whether you're trying to tell somebody to quit smoking, quit drinking, lose weight, get your child vaccinated. Nobody wants a finger pointed in their face and being told how dumb they are and how they're making the wrong choices. So we want to work with people. That being said, this is pretty concrete. We have, and Director Onwuda showed the slides from the year 2000 to now, but if we showed from 1900 till now, we would see that when the vaccine was introduced, the cases dropped tremendously. Like almost it was declared eradicated in the United States. We know that vaccines work. We know, and you've alluded to it, that the connections that people have tried to make with vaccines and autism, there have been no studies where that's been borne out. And actually studies that did make those links have actually been retracted. I personally think it's good to ask questions. But in this case, I think it's quite clear that this is a safe vaccine that works, and measles is completely preventable. So even if the vaccine's only 95% effective, if everyone was vaccinated, we would not have cases of measles spreading in our community. So we're trying, but back to your question, we're trying to reach out and give people information. So, because that's ultimately, unless somebody is in a situation where it's mandated so that they're protecting other people, it's not about protecting yourself. It's about protecting the people around you so you're not spreading illness to others. Thank you.
Yes, Mr. Young?
David Young. Okay. I mean, Jean Mayer just brought this to our attention. The measles vaccine was introduced in 1963, and it was flatlined before the vaccine was introduced. So
I don't have a copy of what you're referencing. I haven't seen
yeah,
that.
I'll get this to you.
Okay.
But so you're saying this is misinformation?
I don't know what that is, so I can't speak to it. Yeah.
Okay. And what about the adverse? What about the adverse effects from the vaccine that Jean mentioned here? These are noted, and I've talked about the adverse effects from the COVID-19 vaccine that VAERS report. I know we're not talking about COVID-19, but I mean, you do have adverse reactions from from these immunizations, and they're listed here on page 2 that she brought to us. So I suggest that we read this, and this goes back to what I talked about earlier today, which is we're talking about 2 cases in Kane County, or 1 case, right? Is it 1 case or 2 cases in Kane County?
None right now.
Oh, 0.
Right.
Okay, let's start about how many in Illinois? 8?
8, and
Was it
but
8?
it's going to continue growing, right?
Maybe. But here we are.
Well, not maybe.
Talking,
Yeah.
we're talking about 8 cases. Okay.
Comment about the
Well, hold on a second. Let me finish real quick. But here we're talking about 8 cases in Illinois, and I'm on the CDC website right now, Madam Chair. And the CDC leading causes of death, 702, 880,000 per year. Heart disease, followed by cancer, 608,000. COVID-19, 186,552. The vaccines from COVID is around 50,000. We're talking about 8, right? This is what we're spending our time here in public health, talking about 8 cases, 0 in Kane County. Yet we should be talking about how can we make Kane County, this is what I'm getting at. How can we make Kane County citizens healthier? Okay. And this isn't it. The Kane County citizens are suffering from what the lists on the CDC website, which is heart disease, cancer, stroke. And we're spending our time doing this. It's very, very frustrating. I'm sorry. And I think we could do a little, we could be more serious about this. Yes. And if you have measles, okay, stay away. But if you're vaccinated, then you're fine. So the people that are vaccinated aren't going to get the measles.
Yeah. May I make a quick response?
Yes, please.
So yeah, I think these are excellent points you're raising, Mr. Young. One, we focus on measles because it's something that we have the means to completely eradicate. We have a safe, effective way to get rid of it. So these are deaths that are occurring in our country that we are concerned because vaccine rates are going down. We're concerned that this is going to start trending up, and it's something that we shouldn't be dealing with. It's something that we have addressed. I don't disagree with you about chronic diseases. That's much more complex. Now, there's not a simple shot, even with Ozempic and Wegovy and all the weight loss drugs out there. That's a complex issue where you have a lot of behaviors. The environment is a major issue that plays into it. A lot of the interventions that would help people to be healthier are quite honestly frowned upon in this country and are viewed as being very paternalistic. Nobody would want the health department to make them do push-ups every day or to knock the cheeseburger out of their hands, right? We give people free choice, and I support that and live in that. So the interventions that we have at our disposal to help in cases like that are more limited because individuals have choices that they can make ultimately. So I agree with you. More should be done about chronic diseases completely. But we market sugary cereals to children. To stop doing that would require more regulation of how we do marketing. As a country, we have decided thus far that we don't want to regulate advertisers, that we want to be able to advertise and put images in front of kids of sugary cereals over and over. And you've probably seen there's documentaries where, you know, kids are more likely to recognize a picture of Burger King than of Jesus because they see those images on TV so many times. How do you stop that? Regulation would be one way, but I don't, if I brought you regulations, I don't know that you would vote yes to them.
It's very complicated.
It's
Yes.
very complex.
Mr. Young?
Yes.
One more comment and I'm done. But not, just say something though.
Yes.
See, the problem, Madam Chair, is that nothing is being said by the Public Health Department. What you could do to stop heart disease, which is stop eating a hamburger. Okay. No. Okay. Yeah. You can't force someone to stop eating a hamburger, but you could say, hey, don't eat a hamburger. Don't eat 10 chocolate chip cookies a day. I mean, and I bring up chocolate chip cookies because that's my issue. And you know that. And I mean, I consumed like 8 of them last night when my daughter, made chocolate chip cookies. But seriously, I'm going to share it.
I don't see him.
I'm not sharing that.
More sharing, it would be less for you.
See, that's exactly right. But on a serious note, this is what I'm talking about. Bring public health to the public and inform them you shouldn't do those things.
Message received, and I agree with you. So we will follow up. Thank you.
Yeah, I just like to comment too. Absolutely. I mean, and I mentioned that earlier. I mean, chronic diseases, but also, prevention. We have those problems. Those are very complex issues, with the chronic diseases. Do we really want another thing, with hospitalizations, like 1/3 of the measles patients end up hospitalized? I mean, we really don't want to be in that situation where it's going to cause more problems. We could nip this in the bud right now, as Barney Fife said, and Andy Griffith, and spreading the information that people need to make the, knowledgeable choices about what they do with their kids. We need to do that now before it does spread. That's just my.
And
Ms. Lewis, you've had your hand up for a while.
Yes. Better make sure I'm on. Okay, I have 3 questions. First of all, I agree with everything that's being said. Since measles are preventable, let's make sure that we prevent them. And also I agree with Mr. Young, and anything that we can continue to do to constantly keep, chocolate chip cookies out of people's hands, let's do it. But here's my 3 questions. Number 1, and this is out of ignorance. So are the measles strains now, are they the same like strain of measles that I had when I was a kid? Because, I'm full disclosure, I was born in 1958, so they didn't have the measles vaccine. So we all had measles. Is it the same strain, or are they worse now? Because generally when new strains come back, they're worse. That's number 1.
Let's have an answer before you get to your next.
Okay.
Measles strains, like every virus, mutates, but essentially the vaccine that we have, works really, really well with the measles strain that we have. So as of now, it's still as effective as it was when you had it as a child.
Okay.
So the mutation is not as bad as COVID, that mutates so much. But every virus does mutate, but essentially the core of the virus, which is what the vaccine addresses, right now, the vaccine really works really well.
Okay, thank you. Then secondly, once you've had measles, are you immune from them?
Yes.
Okay.
You are. Mhm.
Okay, that's what I thought. Okay, and lastly, this is I saw you had some flyers available. I am sitting right now at Marie Wilkinson Food Pantry watching them getting ready to do distribution. And any flyers that you guys can get over to us, especially if they're also in Spanish, we are always willing to put them in our distribution bags. And that could be on heart disease, that could be on anything, because we reach a population that might not, have their kids actively in the school, or they might not, they may be the grandma who's never seen them. And they're more likely to, if their kid has a rash, they're going to take them to the emergency room because that's the healthcare they have. They don't have a doctor they're going to call. So they're going to go to the emergency room with this child with measles. So if there's anything we can do to get in front of that population, more than willing.
Great, thank you.
Thank you so much. I noted that and I'll follow up with you. Thank you.
Okay, perfect. Thank you.
Any other questions? Mr. Greig?
Thank you. Michelle, did you have something, by the way?
Oh, I just wanted to say that I know on our website, our health department website, we do have all kinds of different insights, you call them insights and stuff that do address eating things. And I mean, it covers a whole bunch of stuff. I think to Mr. Young's point, I would hate for us to ignore a situation. I think it should be included in all of the things that we do. So I respectfully say that we should add that to our programs, but we do have those things on our websites that we just addressed. So maybe we can message them better or whatever, but they are available on our page. So.
And I think to eliminate something that we can eliminate pretty easily is part of the focus, so that we can then focus on the things that are not quite so simple. Mr. Greig?
Thank you, Madam Chair. So we're kind of all agreeing, but I'm going to go back to the earlier phase of this meeting when we were talking about resources. So if we have a limited amount of time, if we run a department primarily on grants, when I figure out what I want to focus on, if I'm in the health department, I'm going to be very, very judicious in how I allocate my ink, my time, my presentation at committee meetings and whatnot, because I look at the same basic information Mr. Young was looking at. There were 3 measles deaths in 2024 nationally. Okay. And there were over almost 3 million deaths from a whole bunch of other causes, right? If you look at, and we're going to talk about, we're taking time to talk about gun violence, right? In 2024, there were 19,000 gun deaths, which is, I'm not minimizing that, but just any kind of death is not a good death, but that included accidents, actually. So if I have a limited amount of resources and I have a limited amount of time, not that I want to exclude talking about something like measles, but can I make people get measles vaccinations? No. Can I make them not eat chocolate chip cookies? No. So what am I going to do? I'm going to try to have the biggest impact on healthy living, which includes some vaccinations and things like that. But my concern is that we always go to the, if you don't get this, you're going to die kind of thing. And this is really scary. And there's all these things. Well, how many people have died? 3 nationally. So I'm probably not going to be too concerned. I mean, I had chicken pox as a kid, which I got because my mom took me to my neighbor's house we had chicken pox parties. And that should have taken care of me. It was loads of fun. I hated my mother after that. No, I didn't.
Thank you for your opinion, but I think we need to move on.
Okay, thank you.
And one of the things that I, again, will say, it was just 3 deaths in 24, but you can see that it has risen drastically this year. And
It's actually,
again,
it's 25 so far, 3 deaths in 25.
yeah, right. And so if we have a simple solution, that's why we focus on something that we actually can do something about. So
And one note, and I don't disagree with any of the comments actually, but we are the local public health authority who is charged with containing infectious diseases. So as we talk, and this actually goes into the budget conversation, as we talk about mandates, nobody mandates us to talk about cheeseburgers or chocolate chip cookies. We should, because that's good public health. We are mandated to control communicable diseases. So I just would slide that in.
so we're not just a pretty face here. We're just trying to do what we can do. Yeah. So we're more than just a pretty face here is what I should have said. So, okay. So
And one quick thing, we did launch something called Making Kane County Fit for Kids, which we had funded through the Kane County Health Department. We did tremendous things, which I can share, where we were changing the food environment, just like just say no doesn't work. Just telling people not to eat chocolate chip cookies doesn't work. We need to make environmental changes, which includes how pricing works. It includes what's in the food environment for people. As our funding diminished, we offloaded that program. So now it's a 501c3 that operates in the community. Kane County is still an active partner. We provide grant funding through that not-for-profit organization to focus on health and wellness for children, physical activity and nutrition. So I can share more at a future meeting about that.
and I think that bringing it back to at the beginning with, there's nothing that money can't help us, right? I mean, we're all suffering that right now. So
Well, they say it can't buy love, but I don't,
Ms. Juby.
I'm sorry, it took me a while, but as to reach out for homeschoolers, and this, I'm not trying to say this I don't want to take it the wrong way. If you do a real quick Google search of homeschooling groups in Kane County, homeschoolers are super, super organized. And you can find them. There's a Chicago chapter that a lot of them belong to. There's actually a St. Charles parent group. There's a Geneva parent group. There were just too many for me to like send over to you guys, but a Google search will tell you, because they are really organized. The homeschooling parents are. So there is mostly an organization you can hit and get a good percentage of them in your outreach.
Are we okay over here? Okay, so that was great discussion. Thank you, everybody. And we're ready to move on then.
So we do have one resolution authorizing acceptance of a state fiscal year 2026 Illinois Department of Human Services recovery-oriented system of care grant. So this is,
I was just gonna say, we need a motion in a second so we can discuss.
Juby moves.
Juby
Tarver
moves.
seconds.
Tarver seconds, thank you. Go ahead.
so this is a $150,000 grant that we have applied for. We have not received a award notification, but just so that there's not a delay, because frequently funders want a signed contract back more quickly than our county process allows. So this is asking for permission to work with the state's attorney's office, review the contract, and would allow us to accept this grant if it is awarded to us. If we do get awarded this grant, then we would be making a budget adjustment too. So you would be seeing additional action. Basically, what this is this is a perfect complement to our work around people who are struggling with substance use and recovery oriented. This ROSC is really having people with lived experience who can work together to help people, support them, help them navigate to get into care, to get into treatment. And this is something that other communities around us have had for a while. We've actually been waiting about 3 years for the funding to be made available for Kane County again, but it's a perfect complement to what our opioid task force is already doing.
Great. Do we have any questions or comments? Yes, Ms. Juby?
So is this where we get the peer embedding, or do we have peer embedding someplace else and this gives us more support for that?
More support.
Okay, great. Thank you.
Okay, any other questions or comments? Yes, Mr. Young?
David Young, I looked up this, I was very surprised by this statistic of 48.5 million people suffering from this, and they met the DSM-5 criteria. So I looked that up. I didn't know what that was. And I went through it, and they list 10 separate drugs that are listed. And one of those drugs includes caffeine.
Mm.
So am I one of the 48.5 million people? Sometimes I look at these, these statistics and these criterias, and I just think that they just grow and grow and grow so that the number can look much larger. Yes, we need to, I'm going to vote yes for this, but it just bothers me that all of a sudden I'm now part of this group because I may have a caffeine addiction problem.
Mhm.
Really? I have a cookie problem. I have a caffeine addiction problem. You guys
It's
don't
twice as worse if you have cookie problem.
So I just wanted to point that out to everybody. I didn't know what DSM-5 was, and I looked it up, and there's certain criteria, and they do list sedatives, opioids, obviously, hallucinogens, cannabis, alcohol. Those are definitely part of some addictive type of drugs. But when I saw caffeine, and even tobacco is listed as a, on that list. And I just, it's there. I disagree with it. It doesn't matter. I'm still going to vote for this, but I just think that, you keep on growing this DSM-5 into these different categories, and all of a sudden everybody belongs to it. I'm David Young. I have a problem with caffeine and chocolate chip cookies.
Thank you, David. That,
Yeah,
I
good
did not
point.
know that.
Thank you.
That's interesting.
Mhm.
So, yes, Mr. Penis's, you
I
had a
don't know
comment?
how many of these 22 million people have a problem with cookies or caffeine, but
48.5.
yeah, but 73.1% that's not right. If it's 48.5 million age 12 and older, meet the criteria for substance abuse disorder, 22.2 million is not 71% of 48.5. Or am I reading that incorrectly?
Oh yeah, it's more like 50%.
Yeah.
That's what you mean?
Yeah. Let me check on that statistic for you.
Thank you for looking at that.
I think the wording might be wrong rather than that. I think it's confusing how it's worded. So
Yeah.
I'll get clarification before this goes to exec.
Thank you.
Okay, we can still move ahead with this? Yes, okay. Any other questions or comments? Okay, please call the roll.
Arroyo. Okay, you left. Juby?
Juby, aye.
Genesis?
I guess the question I have is, before we move on, do we make this a Scribblers there or whatever it's called, or how do we?
If you're okay,
Scrivener's?
I'm looking for attorney. If you're okay conceptually, then I'll bring a correction and we can amend it on the floor at executive committee, just
Yep.
so we don't have to wait a month.
Okay.
I'm a yes.
Okay, thank you for that.
Yep.
Idea.
Tarver?
Tarver's a yes.
Young?
Yes.
Strathman?
Yes,
Roth?
okay, it passes.
Madam Chair,
Yes,
may I, when you bring that, can you bring the red line version so we know what you've changed, and then also give us a clean version so we know what we're voting on. But I think it's really important to know what we've changed from what to what, especially since we're moving it forward, knowing there's going to be changes.
Right. And we are preemptively doing this too. We don't have the money yet, so this is a good way to do it.
I'm not an attorney, but what they've told me is the therefore is the legally binding part. So we will clean up the whereas, but
There you go. There you go, therefore, okay. Okay, now we have, anything else for you, Mr.?
no, thank
Isaac?
you. Great discussion. Thank you.
Okay. Any old business? Anybody? Anybody? And under new business, we have, could I have a motion and a second for the proclamation on gun violence?
To be moved.
Hey, Madam Chair,
Moves.
Madam Chair,
Yes, Ms. Lewis.
I had my hand up. I just want to say
Oh, I'm
something real
sorry.
quick on old business. No, it's okay. I just wanted to real quick bring up, and I think it's old business. I read an article in the Herald the other day, and Mr. Isaacson was quoted in it, and it's about the potential loss of funding for our Narcan distribution. And this totally concerns me. And you don't have to answer this today, Michael, but I'd like to know what proactive things we're doing to make sure that we continue to have funding after this, because it's proven that Narcan does save lives. And I go to a lot of these outreaches and the word is still not out there. I bet 30% of the people come up and go, we don't even know what Narcan is. So I think it's crucial that we continue on with this. And I just want to make sure that we have a plan going forward on it.
Do you want to make any other comment about that?
No, yes, I guess at this point, we're looking at what's going to happen with the new federal budget. Of course, a lot of the support for substance use comes through the federal government. Even if that funding makes its way through the state, we have not heard anything about funding for naloxone being eliminated right now. So it was a very speculative article in terms of what could potentially happen. I think as we talk about cuts to Medicaid, cuts to affordable housing, there's other things that put pressure on people who may have struggles with substance use. There are opioid settlement dollars that are available at the state level and at Kane County level that could support naloxone. So a lot of the funding, just like the health department, the state health department operates the same way, where they're very categorically funded. So a lot of this funding is woven together, which makes it complicated, but it also adds a little more consistency because sometimes we're able to use other funds. So as of right now, I have no reason to believe that naloxone funding is going to go away, but it would be a major concern if it did.
Yeah.
Okay, thank you. Like I said, I read the article and of course I pinned it on my refrigerator to check with you. So thank you very much.
And I should point out, currently naloxone is made available to us at the local level at no charge. That's paid for at the state level with other funds.
Correct.
Madam
Such
Chair,
a successful program. Ms.
Yes, it
Gums.
is.
thanks for bringing that up, Ms. Lewis. Just Gums here. Just want to let you know at a broader level, our county team is working and will continue to work with the legislators to maintain the funding that we have. You're all aware of the environment, but it's something that is something we're fighting for. So
Such a successful program.
Yes.
Okay.
Thank you.
You're welcome. Okay, so now we are going to the National Gun Violence Awareness Day proclamation. And I have asked if Mr. Tarver would read that for us. Mr.
Madam
Tarver.
Chair, we did not get a second on the motion.
Pardon me?
We did not get a second on the motion because Ms. Lewis had a question in the middle. So
We did get, Mr. Tarver had second.
Mr. Tarver seconded it?
Yes.
Oh, I'm sorry.
Yes.
Okay,
yes,
thanks,
we do
Bill.
have a second.
Madam Chair, do you want me to read the proclamation?
Yes.
Okay. Recognizing June 7th, 2025 as National Gun Violence Awareness Day in Kane County, whereas gun violence impacts individuals and families across all communities, contributing to the loss of life, trauma, and long-term harm, particularly among young people and in communities of color, and whereas National Gun Violence Awareness Day began in June 2015 to honor Hadia Pendleton, a Chicago teenager tragically killed in 2013. Observed annually on the first Friday in June, the day was inspired by her friends and family who wore orange, now a national symbol of the gun violence prevention movement. And whereas from 2015 to 2022 in Illinois, firearms were used in 84% of homicides, 36% of suicides, and 50% of all violent deaths involving individuals under 18, and the highest rate of non-fatal firearm injuries occurred among those aged 20 to 29, followed by youth aged 10 to 19. And whereas between 2018 and 2022, Kane County reported 141 gun-related deaths, including 81 suicides, and 410 gunshot wound injuries treated at local emergency departments. And whereas the Kane County Health Department is actively working to prevent firearm injuries and deaths by offering free gun locks to households and retailers, promoting safe firearm storage to reduce the risk of suicide and unintentional injury. And whereas National Gun Violence Awareness Day honors the lives lost to gun violence and supports continued efforts to strengthen gun safety laws and educate the community on safe gun storage. Now therefore be it proclaimed that the Kane County Board designates June 7th, 2025 as National Gun Violence Awareness Day in Kane County, Illinois, and encourages residents, businesses, and organizations to work together to reduce gun violence and promote safe communities for all.
Thank you, Mr. Tarver. Any comments or questions? Yes, Mr. Gray.
Is there any reason this is only a day? And I know nationally it's only a day. Can we edit this to make it the month of June? And I know we have June for other stuff too, but this is a problem. And I think the more specifically we focus, the less attention it would get. And I'd love to see this at least be for the month of June so we can talk about it more.
Well, I think that's a very good point, and I think it is, even a month is not enough, right? This proclamation is for the day, but I think it is an ongoing awareness we're trying to raise in King County with the programs that we're doing. But that's well spoken. So any other comments or questions? Mr. Young?
Hi, David Young. This is a politicization against guns, and I'm against this. If you look at state of Illinois, I did some research. In 2023, Illinois had a violent crime rate of 310 per 100,000 people. Now, what is violent crime? It's aggravated assault, robberies, rapes, and murders. And I'll let you know that 48.6% of that 100,000 out of 310 out of 100,000 is what the statistic was. So out of those 310, 48.6 are aggravated assault, 35.6% are robberies, 13.7% are rapes, 2.1% are murders. And of that, 83% are committed by guns. So that means 1.7% of all violent crimes are committed by guns. Yet here we are, again, talking about guns and trying to take guns away from people by politicizing this. And I'm going to be voting against it. But again, we talk about the other problems that we have in public health, which I mentioned, which are the heart diseases and everything else that we have. Yet we're going to have a proclamation focusing on guns. So I'm going to be voting against it. Thank you.
Ms. Gums?
Ms. Juby.
Ms. Juby?
So I anticipated you were going to say that. And so kind of as a joke, I typed in how many murders were done by hammers in the United States in 2023. It's 317. In 2023, there was 7,159 murders committed by handguns, 5,295 firearms that were not stated as handguns. There were other guns of 398 and shotguns at 166. So I think the reason why we have singled out things that fire bullets isn't because it's politicized, but because it's one of the largest murder weapons used according to statistics by crime and law enforcement. I also went back and I double checked it with another website, which I thought was going to give me very different information because it looked like it was going to be one that would give me different statistics for various reasons, and it gave me the same statistics. So I appreciate you're going to vote no. We agree to disagree all the time. It's not politicized. It's because it's the #1 murder weapon in the United States. And if it's not the #1 murder weapon in Kane County, yay. But I think that we need to recognize it. And to Mr. Gripe's thing, we do one day because there happened to be a horrific thing that brought a bunch of people together that started a movement. It should be all the time. We should be talking about things like this all the time. We should be talking about heart disease and diabetes and things that are preventable. But we can't do everything all at one time. It doesn't mean we can't do things concurrently. And so happy that you are consistent and I'm consistent. And I think that cookies should be in the DSM-5 because it is, sugar is
Cookies.
actually an addicting thing. But that's my belief on why we have things like this. So I will be supporting it until that number goes way, way down.
Thank you, Ms. Juby. Ms. Gums, you had a comment?
I do. I just want to respectfully disagree with my colleague, Mr. Young. As you know, I'm a gun owner, a Democrat gun owner. Anyways, we're not born with a gun in our hand, but we could be born with a heart problem. We're not born with cancer, but we could acquire cancer. We choose guns, and all we're saying is we have, it's again, just including it. And I don't think that we should exclude it because some people make it political. I don't want to take your guns away. I like my guns. But it's a reality that this wasn't, as Ms. Juby said, a movement. And I can respect that opinion, but I just feel like we're cutting ourselves short if we exclude things that we don't like. And I would recommend you all support this because it does in fact happen.
Thank you. Mr. Tarver, you had your hand raised.
Thank you, Madam Chair. And just to kind of echo what my other colleagues have shared too, I mean, the proclamation says gun violence awareness. So it's really not going after people and trying to remove their guns, which my colleague also shared too. This is really about safe gun storage and the public health department's awareness of trying to prevent those accidental deaths in some of our youth and teenagers. Not only talking about, suicides and other violent deaths that occur, but it's recognizing the awareness. So how can we share that information? It's bringing this information to our community and the people around us to let them be more aware. And I applaud the work that the health department and other agencies are doing to try to minimize and decrease these statistics. And these statistics don't lie, they are facts. So like my other colleagues too, I will be supporting this, and thank you for the time.
Okay, thank you, Mr. Tarver. Anybody else? Mr. Penesis.
Yeah, actually, what Bill just said, that's basically what I was gonna say, gun ownership is increasing, this is not stopping people from, getting guns. It's being consistent here, prevention, making sure that first-time gun owners know how to store their guns properly. I think it's really critical that we do that awareness just from that perspective, that offering the free gun locks to households and retailers, promoting safe firearm storage to reduce the risk of suicide and unintentional injury. Those are very, very positive preventable measures that we could provide to people. So yeah, I'm voting yes on this too.
Mr. Gripe.
Kind of a wish maybe for the future, but as I'm looking at this, and I agree with everybody, David, I'm a gun owner too. But if we could maybe, the committee, and I'm not on it, could consider a violence, anti-violence, whatever. Thank you. In the future, because I think sometimes we say to people, well, guns are the only thing that hurt people. We all know that's not true, but it could be fists. I mean, I spend time as a mentor in an elementary school and, up to sixth grade. And I watch these kids on the playground and we all read about other stuff. So I think just getting people to realize that I can use my car as a deadly tool, road rage, anything like that. But I'd love to see maybe somebody develop that thing. I'd be glad to work on it for the future.
My only concern about that, my only thought about that is that you can die from gun. If you don't know how to handle a gun, if it's not locked, it doesn't mean that it's a violent situation, but you still can be injured by it. And this is focusing on gun education, gun safety. It's not just violence. So thank you for your thoughts.
Yeah, this isn't against this. I get, it's just for the future, maybe broadening.
Well, but in the future too, we want to make sure that we educate people, not just on violent things. So we would want to include this as part of it. So yes, Mr. Young, and this will be the last comment.
Thank you. David Young, piggybacking on what you just said, I think it's a great idea to educate people on guns. And I've said this before, and I'll say it again, is that why not train people on how to shoot a gun, how to load a gun, how to clean a gun, how to use it properly? I mean, that would be definitely part of the education of guns. Definitely, you definitely need to know that they're dangerous for sure, but make sure you know how to use it properly, effectively, safely.
And I think that's an excellent idea. And there's some people who would say that that should be part of the gun registration and gun buying. And some people are not for that kind of restriction. But I agree, it'd be a great idea to make sure that people who want guns and have guns know how to use them, because we all know it's not the case right now. I think that's a good idea. So, okay, I think we're ready to take a vote.
Okay, Juby,
Juby, aye.
Genesis,
Genesis, yes.
Carver,
Tarver, yes.
Young,
No.
Strathman,
Yes.
Roth.
Roth, no.
Looks like it does not pass. It does pass.
Okay, it does pass. Okay. Okay, so I don't think we have an executive session that's needed. And the reports, I would like to ask for a motion to place the reports on file. I always say replace the ports on file. Place the reports on file.
David Young makes unanimous consent to replace,
Thank you. Any objection?
replace. I did it. I just did it.
Uh-huh.
You just place the reports on file.
It's contagious. I'm just saying.
I'll make everybody know, I just got a suggestion that from someone just texted me that we should create a caffeine and cookie awareness day.
That proclamation, I'll vote yes.
Me too.
Of course, I will put that on.
As long as there's cookies and caffeine here.
Bye day.
Have a motion in a second to adjourn.
Roth will make the
Madam Chair, really
motion.
quick.
What was that?
Madam Chair, I just have a quick question.
Yes.
I noticed in some of the votes today that Mr. Roth was voting. Is that due to a quorum, or could you please explain that?
Yes, he is here for quorum.
Thank you very much.
Mr. Arroyo left.
Alex.
Is it possible?
Strathman, Juby, Genesis, and Young is 4.
Yeah, so you didn't need.
We
my-
don't need Bill Roth for
Oh,
quorum.
Okay.
You can strike my vote.
Oh, let's do that. Okay, thank you, Mr. Tarver. Math is not my first love.
Then I make a motion to adjourn.
Okay, thank you, everybody. This was a great meeting, a lot of great discussion. Thank you. See you next month.
All in favor?
All in favor?
Aye.
All right.
Aye.